As an interventional cardiologist, I think it's absolutely crucial for me to be able to effectively communicate the results of coronary diagnostic and interventional procedures to my patients, their families, and referring physicians. This ability to communicate results is one of my highest priorities because this type of information and education is essential to improving outcomes and treatment compliance. Well-informed patients consistently do better when compared to poorly educated patients, and there are data suggesting that the visual impact of a patient's disease burden can be very helpful in stimulating patients to adhere to important medications and lifestyle modifications. And now with the captureproof platform, using a smartphone allows instant communication to occur in a way that is very practical and feasible and consistent with a busy schedule, and importantly is HIPAA compliant. Now I can instantly and safely share image results with referring physicians who now don't need to wait for a CD to reach them or a phone call describing the results. They can be rounding on their patients in the hospital, sitting at home, or even be at their son's soccer game and have an instant visual update of the angiographic results. Also, the complexity of the procedures that we perform and their interpretation is such that the ability to review and compare with previous images is also essential. The capture-proof user interface allows me to arrange images chronologically and instantly compare them.
Hey medstartr, captureproof is on a mission to change the face of healthcare by solving one important problem. Doctors and patients don't speak the same language. Captureproof is changing the way patients communicate with their doctors and the way doctors communicate with one another. Captureproof brings the unclear into focus, turns the impossible challenge of describing a seizure with words into the clear visual of the event. The challenge to explain what is happening inside a patient's body to the clear visual representation. Whether the data is created in a patient's home or in the hospital, captureproof is the only HIPAA-compliant platform for doctors and patients to capture, compare, and share photos and video. Photos arrive organized, are easy to find, and legal to receive. This is a second-degree burn, healing in reverse. Captureproof takes it a step further with our patent-pending comparative organization tool, allowing instant analysis at a glance. Simply grab and drag and track through time. With 2 data points on the screen, it makes it clear if the patient is getting better or not. Captureproof manages medical videos as well. Easily watch 2 videos side by side and see and know how the patient is progressing. Captureproof turns the mobile phone into a medical aid, allowing doctors to more accurately triage and remotely monitor their patients. Captureproof's mobile app makes it easy to get the same photo over time with our patent-pending overlay. Simply line up and snap. For captureproof, functionality and security go hand in hand, and we have done what it takes to become fully HIPAA compliant. So doctors, patients, and hospitals no longer have to worry about the potential dire consequences. In the event of a lost phone, captureproof has it covered. The time is now. 40% of doctors believe that mobile health can reduce office visits. 86% of doctors have smartphones in their pockets, and 88% actually want to monitor their patients at home. Captureproof is disease state agnostic and has the ability to help patients get healthy from weight loss to a cardiac event and everything in between. And let's face it, there are many things in between. Through medstartr, we invite you to be part of the solution. With your support, we can show the entire healthcare industry across the world that we are all ready for a simple yet radical shift, and that solutions can be easy. Join us, donate, spread the word, hit the button, share on your Twitter. All of this, but please remember, because it won't be long until your doctor tells you to take 2 photos and call me in the morning, and when they do, capture proof.